This training is about hospital financial assistance. It is a module for the CHAS certification training series. The Hospital Financial Assistance Law requires all New York State hospitals to offer hospital financial assistance to patients who cannot afford to pay their bills. All hospitals must follow the same rules and use the same application form. Hospital financial assistance is usually only available in New York to cover hospital bills. However, provider bills are usually not covered by hospital financial assistance. However, doctors who are employees of hospitals are subject to the hospital financial assistance policy of the specific hospital. If a patient is approved for hospital financial assistance, some doctors who are not employees of the hospital may offer discounts, but they're not required to by New York's hospital financial assistance law. So sometimes a good negotiation tool, if your client is approved for hospital financial assistance with the private provider debt. New York's hospital financial assistance law started in 2005 and was called Manny's Law. Reforms went into effect in October of 2024. Those reforms were pretty significant. Now, after October 2024, hospital financial assistance applies to all New York State hospitals. Patients with incomes up to 400% of the federal poverty level are eligible for hospital financial assistance. There is no asset or resource test for hospital financial assistance in New York State. The underinsured are legally entitled to hospital financial assistance, and there's a specific definition in the law about who is considered underinsured for the purposes of hospital financial assistance eligibility. Patients can apply at any time. There's no deadline for hospital financial assistance applications. Hospitals cannot deny care to patients with unpaid bills. Payment plans must be capped at 5% of a family's gross annual income, and interest rate charged on bills must be capped at 2%. There's other patient-friendly provisions and consumer protections in the law. Specifically, patients must receive written notice of the availability of hospital financial assistance at intake, registration, and discharge. So there's 3 points where, and on bills, so there's 4 points where consumers must be told about hospital financial assistance. Immigration status is also not an eligibility factor for hospital financial assistance. As I said, hospitals cannot deny admission or care to patients with an unpaid bill. Hospitals cannot sell medical debt to third parties, and hospitals and providers cannot require credit card pre-authorization or that a card be on file before a patient gets care. Patients must be informed of the risk of paying on a credit card if they decide to do so. And medical debt cannot appear on credit reports. These links in this presentation are to consumer or advocates facing documents on these different sections of the law that might be helpful resources. So again, medical debt cannot appear on credit reports or impact credit scores, including debt that's incurred on a medical credit card. For example, care credit. And hospitals cannot sue patients with incomes below 400% of the federal poverty level. There's a link on this slide to a resource that compares the old hospital financial assistance and the new law and the new law. So before helping your consumer apply for hospital financial assistance, determine whether insurance can pay or if the consumer can be held harmless for bills. And there's other billing and medical debt trainings that go through like how to handle these cases specifically. Um, but ask the hospital to resubmit the claim under a different code. For example, an inpatient hospitalization may be resubmitted as an outpatient or observation status um, visit, and that recode may be paid by the plan in full. Help the consumer appeal denials with their insurance company. And again, there are trainings in this certification that explain formal and informal advocacy methods for getting a consumer's denial overturned. If the consumer is uninsured or the service is simply not covered by their insurance, investigate whether they can get retroactive coverage. Medicaid, for example, may go back 3 months from the date of application retroactively and cover a service. And for employer-sponsored coverage, the consumer should consult their HR or employer to see if they can get reinstated. And for COBRA, eligible enrollees can select COBRA within 60 days of receiving their COBRA election notice. So can get retroactive coverage for that period, potentially. Okay, so now we're going to um, talk about how to assess eligibility for hospital financial assistance, and what steps to take when reviewing a case, a consumer's case. So the first step is to review the facts. How did the consumer end up with a bill? Do they actually owe it, or is their insurance company at least partially responsible? Is the consumer's income under 400% of poverty? If so, how do they qualify for hospital financial assistance? Are they uninsured, underinsured? Have they exhausted their insurance benefits? And then step 4, help the consumer fill out the application. Apply with a cover letter explaining their circumstances, their income, and how they might qualify. If necessary, appeal or file a complaint with the State Department of Health. And we'll talk about some bases for doing that. So on this slide, we talk about hospital financial assistance eligibility. If a patient's income is under 400% of the federal poverty level, they are eligible for free care at no cost. For patients with incomes between 201 and 400% of the federal poverty level, there are 3 different eligibility categories by which they may be eligible for hospital financial assistance. The first one is for underinsured patients, for uninsured patients, patients who do not have health insurance at all. Hospitals may require those patients to apply for Medicaid to get retroactive coverage if they're eligible. If a consumer was uninsured at the time of the service but now has coverage, their application should be processed as uninsured because obviously they're unless the coverage is retroactive, their insurance is not going to pay the bill for a time when they didn't have effective coverage. Then there is a category of eligibility called when patients are underinsured, and this one is a little bit tricky. This is for patients who have insurance but have accumulated medical expenses worth more than 10% of their gross annual income, so their income in the past 12 months. This can be out-of-pocket costs at any facility for any sort of cost sharing except for monthly premiums. So if a consumer has a deductible, bills for co-pays, for prescription drugs, for co-insurance costs, these bills only need to be accumulated by the consumer in the past 12 months. They do not need to be paid bills. But of course, they need to be the responsibility, the cost sharing responsibility of the consumer. And I'll talk a little bit more about this tricky category of eligibility. And then consumers may also be eligible under the exhaustion of benefits category. So that's for patients who have exhausted their health insurance benefits and can demonstrate an inability to pay. And for these patients, they should have a compelling cover letter with their hospital financial assistance application. You can help them write it, which demonstrates why you think they cannot afford to pay their bill. And we have some template resources available. So applying for hospital financial assistance, hospitals must post their application, financial assistance policy, and a summary of that policy on their website. It must be public facing. So you can find the specific hospital's policy and application on their website to help consumers apply. Help the consumer complete the application. There's also resources on completing the application available on the job portal. Gather required supporting documentation from the consumer and attach it to the application. So, for example, proof of income, any information that might help the consumer demonstrate the monthly expenses that they have. Um, Apply if the consumer meets the eligibility criteria on the previous slide. If the consumer does not meet the income eligibility requirements but can show an inability to pay the bill, apply anyway. The hospital cannot send your consumer's account to collections while a hospital financial assistance application is pending. And many hospitals go beyond the 400% eligibility, income eligibility requirements that are in the law and may consider your client's application if they can demonstrate that they have an inability to pay the bill. If the consumer is denied, they can appeal and prove their inability to pay by providing proof of expenses. And we'll talk about how to do this and resources available to help consumers do this. So this slide explains what supporting documents the hospital can and cannot ask for. Hospitals can ask for pay stubs, proof of New York State residency, because of course our hospital financial assistance law applies only to New York State residents. An example of income can be a Social Security award letter, for example, a pension award letter, an award letter regarding unemployment benefits, or a NISO eligibility determination page. They cannot ask for tax returns, proof of citizenship, Social Security number, information about bank accounts and resources, savings accounts, monthly bills, and expenses. Now, of course, a consumer can supply this information if it's useful for their application, but they can't be required to supply this information in order for the hospital to process their application. And if necessary, complain and appeal. Patients have the right to apply for hospital financial assistance in writing. If a patient is denied hospital financial assistance, they have the right to appeal. Reasons why an application may be denied are if a consumer's income is over 400% of the federal poverty level, if a consumer lived outside of the hospital service area, if the consumer is not underinsured because they do not have paid medical expenses exceeding 10% of their gross annual income. We know that according to the law, medical expenses to be considered underinsured only have to be accumulated by the consumer, so not paid. But as of the spring of 2026, hospitals are relying on a DOH application and guidance that says bills must be paid, and this is contrary to the law. For if a consumer's hospital financial assistance application is denied on this basis, appeal and file a complaint. Now we're going to discuss helping a consumer appeal their hospital financial assistance decision. If your consumer gets a hospital financial assistance decision or award that they think is incorrect, or that it wasn't calculated correct, or that they simply just cannot afford, um, they have the right to appeal. Some, in terms of appealing denials, follow the appeal time frame set by the hospital. There should be an appeal time frame in the decision. There is none set in the law. So you have to be careful to read the notice and understand what the time frame for appealing is. Um, the denial must have detail about the reason for the determination, the denial or award, actually. It must say what sliding fee scale was applied, what they determined your income to be, and how they came up with the discount that you got. A few words aren't enough. So if it doesn't, if the determination does not explain what the award is based on, that's definitely something that should be appealed. Appeal if you believe the consumer was actually eligible if they were denied, or believe the hospital's reason for the denial was not sufficiently detailed, or just what didn't was incorrect. And then, of course, you can also appeal favorable awards. Any hospital financial assistance decision is appealable. Hospitals can give financial assistance to patients whose income are above 400%, but they can demonstrate an inability to pay, as I said. So gather supporting documents from the consumer, like monthly expenses, proof of other debts, and recent pay stubs. And of course, write an appeal that demonstrates that the client really has a hardship and cannot afford to pay, despite their income. And then here are some reasons to complain to DOH. Um, hospitals are hospitals may require a patient to submit income tax return. That is not allowed under the law. They can submit an income tax return if that's proof of income that they have, but they can't be required to. If the hospital took longer than 30 days to make a decision, if they did not explain in writing how the patient can appeal, um, if they required the patient to come into the hospital and apply in person, if the patient was deterred by pre-screening. So, for example, if they called the hospital financial assistance office or the billing office and were discouraged from applying and told that they were not eligible over the phone. If the hospital didn't apply the correct federal poverty guidelines, sometimes they're using the year that just passed guidelines. If the hospital sent the bill to a collector before 180 days from the first post-service bill, if the hospital asked for proof of citizenship or immigration status, or if the hospital requested proof of a patient's bank accounts, resources, or assets. All these things are reasons to complain to the State Department of Health because they're prohibited by the law. And this last slide has some resources on hospital financial assistance that are on our CHA portal in addition to others. There's a one-pager on eligibility for hospital financial assistance, both in English and Spanish, that's consumer facing. There's a resource for advocates on how to handle a hospital financial assistance case. There's a template appeal letter um, that you can use and um, stick in your client's specific details and information to file a hospital financial assistance application determination that you disagree with or the client disagrees with. So there's an appeal there that you can modify. And then there is a template letter for filing a Department of Health complaint if the hospital is really doing something wrong in their hospital financial assistance application process or their appeal process. And then there's some other resources linked here, the federal poverty guidelines for 2026, the year that this training was recorded, and a comparison tool of the hospital financial assistance law from 2000 and 5, comparing the reforms from 2024. And the Uniform Hospital Financial Assistance application that all hospitals must use statewide is also available here, and the Spanish version. So do know that your consumer can submit this uniform application. It doesn't have to be the hospital's specific application, but the hospital's specific application must conform to this form. It must be the same. Um, And those are the resources. There's additional trainings on billing and debt cases that go into more detail on how to negotiate medical debt outside of um, debt that's specifically from hospitals. And those will be available on the portal.